Heart disease is the cause of 1 in 3 deaths for women each year. Cardiovascular disease kills more women than all forms of cancer combined. We spoke to cardiologist Dr. Grace Huang, who compares heart disease symptoms and outcomes between women and men.
Heart disease is the #1 killer of women as well. The issue is that women in general present about 10 years later as compared to men. So women prior to menopause, it's more rare for them to have heart disease or cardiovascular events. But once we reach menopause, then our risk becomes more prevalent and sometimes unrecognized or under-recognized. So because we present 10 years later, we tend to have more comorbid conditions like hypertension, diabetes, all of the things that come with aging. Compound that onto cardiovascular risk 10 years later is prevalent.
Dr. Huang tells us how heart attacks differ between men and women.
Cardiovascular disease among men and women, there are differences, but I must stress that we do have more similarities than differences. The most common presentation of, let's say, heart attacks in women is, chest pressure, mid-chest, radiating to your back, pressure like pain, just like men. But women, if you compare men and women, tend to have more atypical symptoms. And women's symptoms can be brought up more so by stress as well. So because women do present 10 years later as compared to men, and we have more of the comorbid conditions that come with aging, our risk of mortality and complications of heart attacks is also very high. And again, it's the #1 killer of women: heart attacks, cardiovascular events. Very important to know.
Dr. Huang lists possible symptoms and triggers for heart attack.
So the most common symptoms is chest pain, pressure or tightness. It can travel or radiate up to the neck, the jaw, the shoulder, the back, the arm. It's often triggered by stress or exertion, so exertional pains, exertional symptoms. But women can also have triggers that are non-exertional, like just stress. So a lot of women don't recognize heart attack symptoms because they can say, oh, this is just me being stressed.
There has been a difference in treatment for heart attack between men and women.
Treatments between men and women for heart attacks are the same. So aspirin, being on a cholesterol medication, blood pressure medications, blood thinners, they're the same. And also to perform angioplasty or stenting in the acute setting for acute life-threatening heart attacks is the same as well. The only difference is that for women, we're often underdiagnosed, not recognized as our symptoms being heart-related, and so sometimes there's delay for women as compared to men. So I think early recognition, especially in women, is very important, and not to just discount the symptoms and say, I was just having a stressful day.